Today we are hosting Dr. Matthias Reichert. Is a senior physician at the Department of Internal Medicine, Saarland University Medical Center in Hamburg in Germany. Is also part of the German Society of Internal Medicine and the German Society for Gastroenterology, Digestive and Metabolic Disease. Where he is a member of a working group on complication in liver cirrhosis. Is also part of the European Association for the Study of the Liver, EASL, and he has published several papers and participated in many clinical studies. Welcome. That's a welcome from ELPA. I would like to start with the real broad and general question. Liver Screen project will screen a total of 30,000 people recruited from different European countries using a non-invasive tool, a non-invasive procedure. It's quite a number. I was struck by this number browsing the website of the project. In your opinion, how could the Liver Screen project change and maybe improve the liver patient landscape in the future?
Well, Beatrice, thank you very much for the opportunity to talk with you. And I think from a viewpoint of a clinical doctor in hepatology, we always see the patient with the liver cirrhosis at the end of the disease, when there really is no much chance to cure the disease anymore. And we have to think about liver transplantation, and I cannot do anything about the cause of the disease anymore. So the interest is really strong to find the disease early, at the time point where we can still cure the disease before we reach the point of liver cirrhosis, decompensated liver cirrhosis, where the options to do something for the patients are really limited.
The goal of Liver Screen, but not only the goal, also in general the soul of the project is really cross-border, because 30,000 patients from different European countries is a real European and international, let's say, project. You are responsible for screening patients in Germany. How is your daily? How are your daily activities, and which are maybe the difficulties that you can encounter doing your fulfilling this part of the project?
Well, here in Hamburg, we have a team of people that take part in the Liver Screen project, and we try to work together, meet with these people, and coordinate inclusion of the patients. This will be several general practitioners where the first examinations are set up, and then the patients, like it's in every center for Liver Screen, will be sent to the center where we take care of the patients and look those that have increased liver stiffness, what's the cause of the disease. So the main daily basis is twofold. First thing would be to coordinate the team and to motivate the team to keep including patients and motivate the patients to take part in these studies. And then the second part would, of course, be to look for the patient. What is the cause in the visit to the so-called of Liver Screen? What's the cause of the increased liver stiffness? What's the disease behind this? So these are our tasks. And what are the second part of the question would be what are the difficulties right now? The one difficulty, of course, is the COVID pandemic. A lot of patients are refused to go to the clinic, to the outpatients. We have to talk more with the patient and explain the study and what really is the benefit for the patients to take part in the study. So this would be the COVID pandemic. And the second difficulty is just more general just to keep the patients motivated, because a lot of patients especially during the first visits. Okay, I will do the fibroscan, the first part, but the second part, I have to go to the university hospital. It's a short drive, and we have to convince the patients what's their benefit to come to us and have their liver checked.
I have a last curiosity to fulfill. You mentioned general practitioners as a first step in the recruitment, as a first step. How? I mean, I think that the most they are involvement, the better is for also for the recruiting process. How is this step important? Because I always thought that sometimes it's not such an easy task getting contact with them. Also, medical doctor to medical doctor. I mean, also in not only patients to general practitioner, but also inside the scientific, the medical, let's say, environment.
Mm-hmm. These are usually the general practitioners. These are patients that are usually there for other reasons. And so we come up to the patients and tell them there is the chance to have your liver checked. And some patients are a little surprised. And then also we have to talk about them. How can the patients benefit from this study? What's their goal? And again, the liver is an organ that's not doing any pain. It's so the patients really don't we have to talk to them and explain to them why we have to do early screening, why we have to recognize the disease at a stage that's still curable. That's something that in the population, not all patients are really aware of.
Thank you very much. It was really interesting. Thank you.
Thank you very much.